So this is an MRI scan for Leaf, and he's been having long-standing headaches in the back of his head, and they've been getting worse recently. He's an active guy. And what we see here, this is his nose, these are his lips, this is his tongue, this is the side view, this is the front and the back of the brain. And this is the cerebellum, it's the balance part of the brain. And it's supposed to curve up here and stay inside the skull. But in his case, it's squeezing down below the base of the skull in an opening here. That's called the foramen magnum. It's a big opening at the bottom of the skull. That's where the brain stem comes down and turns into the spinal cord. That's all that's supposed to be there. And down here, the black in the front and the back, that's the cerebrospinal fluid, and that's supposed to bathe the spinal cord, the brain stem. But what's happened is the cerebellar tonsils are pushed down here, and they're pressing on things there, so there's no fluid around there. And that's causing a backup here, the pressure on the brain. And that's the Chiari malformation. It was named after a guy, Hans Chiari, described this in the 1880s. He was probably born with it. The brain is normal, but it's just in the wrong place. And so the operation we did, this is the odontoid process, that's the second cervical vertebra, and it's a bone, it's kind of pushed backwards, a little retroflex. So he's pinching things from the front and the back. And what we did is a decompression here, where we went in the back here, we took a little bit of bone off over here, and a little bit of bone off at the top of the spine to take the pressure off the spinal cord. And then we used an ultrasound. We found that things were pulsating. We were playing Elvis actually in the OR, and the brain was pulsing to the music, and everything was restored in terms of harmony. And then we close them back up, close up all the soft tissues and the muscle and the skin. And here he is. So here he is after surgery. You did this earlier today. Big smile on the face. So that's good. He'll have some incisional pain as the wound is healing. We made the incision. Can you lift up in the back here? And these are all absorbable sutures, and we've got him on an antibiotic for a day to prevent infection. We're giving him some medicine to prevent the pain. But can you hold your arms up? But he's doing okay. His arms are good. He's moving all the limbs. If I look at my finger here, look over here, and look over here, and look up and down, and give us a big smile. Good. So everything's working, and we're going to keep him here for a couple of days, get him up on his land legs, and hopefully go home. So this is a foramen magnum decompression. That's the opening at the base of the skull that was crowded because the brain was squeezed downward. Instead of taking the brain out, we made this space open. It's as if we loosened the belt around his brainstem, or if you think of someone's thumb pressing on his brain or his spinal cord, we took the thumb off. That's the same approach we use if we had to go into the brain to take out a tumor, but there's no tumor. The brain's normal. So you're free at last. Hit the rock. There we go.
Great. And there was a tendon that was very tight, you said, that you loosened up, or?
So it looked like what was causing the problem. Usually the brain is staying inside the skull. His was squeezed down, so the bony confines of the posterior arch of C1, the atlas, were squeezing on it. And then when we removed that, there was a fibrous band. It's called the atlanto-occipital membrane. It was very thick, and that was adding pressure there. And so we divided that, and then we used a sonar, an ultrasound, and we could see through the dura, the linings of the brain, the fibrous lining of the brain, that everything was pulsing normally. And so we were able to stop. If that weren't the case, then we'd have to open the dura and put a graft in. But this was a bony decompression, removing that atlanto-occipital membrane to take the pressure off the brainstem.
All right. Thank you, Dr. Cohen.
Here we go. All right.